Hi. Just like any other profession, global health has its own successes and failures. When it succeeds, it becomes a source of pride for its practitioners and workers because they end up feeling that their work touched hundreds of thousands, millions of lives, even saved lives. But when you get it wrong, it is also a fact that even the most well intentioned project could end up causing disproportionate harm. And this is not something that is being hidden somewhere. This is discussed over and over again in literature and in the development sector as well. What happens is that when you ignore the autonomy of the community and their ability to make correct choices, even the best of the projects ends up as failure. And consequently, the community loses confidence and its interest. Considering this is a recurring theme, our upcoming program, our upcoming conversation with our guest, Dr. Nikolai Petrovsky, identified two key aspects which have resulted in this recurrent failure. And most importantly, Dr. Nikolai Petrovsky argued that this is not something restricted or limited to global health. It is probably more of a policy mindset as evident in sectors. And he gave an example of the sector of technology. Take a listen.
If electric cars are better than petrol cars, the market will just move to electric cars. If electric cars are worse than petrol cars, yes, maybe you could force everyone to move to electric cars by making petrol cars illegal. But what's that saying? You're actually driving everyone to an inferior product or inferior technology. So, so my view on technology is easy. It's if there's better technology, it will replace the more. It doesn't need government intervention or and the same to some extent with public health. That I think that you can have parallel products, and then the consumers and the doctors will make their decisions. So this idea that you have to outlaw things, you know, I think it misses the point. It sounds easy, but I think it paradoxically, doesn't work. It's a bit like, prohibition. How successful was prohibition? Made sense from a public health perspective. Let's just ban alcohol. It would be good for everyone.
The reason I
But
spelling
you know, one, it's a complete failure. Two, it makes encourages the criminal elements because they are the ones who profit from something being made illegal, um, and but ultimately it's depriving everyone who drinks sensibly of making their own choice. And do we all want to live in a situation where we're not allowed to make any choices for ourselves? Those choices are all made by Big Brother. Um, I certainly don't want to live in such a world, and I don't think many people on the planet do. We like to think we have reasonable autonomy to make choices, and that also applies to public health. And for instance, vaccine mandates. Do I support vaccine mandates being a vaccine developer? Absolutely not. And I think if you ask most vaccine developers, do they support mandates, they would tell you they don't. For that same reason, that people behave more normally when they feel they have autonomy to make their own decisions, and most of the time they'll make the right decision. And maybe they need some education or guidance, but they don't need Big Brother, whether it's public health or it's environmental and people outlawing petrol cars or whatever. That's not what humans respond well to, and it creates aberrant behavior, and ultimately it fails and it causes massive problems. So that's my view to public health and vaccines, is no different to my view on the environment and how do we progressively move to a better world. We don't get there by criminalizing and outlawing and mandating and forcing people's behavior.
for all the more reasons. Public health is one field where you would rather uh, let these choices play out in the public. And I even remember that in the last program we discussed that there are millions of projects out there where people were told, or the communities and populations were told, that this is for their own benefit, but lying beautiful buildings,
It does.
beautiful.
It just doesn't. It doesn't work.
Uh,
And we know that. I mean, it's been tried through the centuries, and inevitably, it's failed and backfired. That
but keeps
that
coming back
that you
again and
get
again.
people on side, and by education, by encouraging. Do you know what I mean? You don't get it by this sort of big brother
No,
dictatorial
no.
sort of behaviour. And I think that the current generation of public health professionals around the world, unfortunately, haven't been well trained, or haven't been in the job long enough, because they think it's simple. You just force people to adopt particular behaviours. But that's the antithesis of public health. Public health is about encouragement, education, support. That's what it's about. And so it's a full-time job, and yes, it's hard work because the job never stops. This idea that you can mandate, or you can, outlaw sugar, or you can like do all of these things by forcing, shows a total lack of understanding of public health leaders today compared to public health leaders of the last 100 years, who understood this very well, that you can encourage, but you can't force healthy behavior. And if you
Right.
do, you'll probably make people adopt even more unhealthy behavior. It's a bit like with a child. Often when you're trying to get them to do something, they always do the opposite. They'll always push back. Do you know what I mean? It's in the nature of children. Like the parent tells them to do something, so they do the exact opposite. And so that's I guess inbuilt into humans, this idea of you try to tell me what to do, I'm going to do the opposite. And so we know in public health that's the same, that if we tell everyone you must stop drinking, we're not going to let you drinking, like prohibition, probably there was more people drinking alcohol and alcoholics than there were in the absence of prohibition.
Right.
So that's just human nature, and public health is about understanding human nature. And if you don't understand human nature, don't go into public health, or you shouldn't be allowed into public health, in truth, because you're going
Yeah.
to be one of these people wanting to mandate things and outlaw things, and tell people what to do, as we saw during the pandemic. In many countries, it's not like restricted to one country. It was coming from countries that are on the left and the right and east and west. There were some people who just wanted to force behavior. And those people are still there, unfortunately, because we still see this idea that it's reasonable to try and force human behavior. One, it's against people's civil rights. You can't force, as I say, someone to be healthy without infringing all of their rights that are enshrined in international law, these principles of civil rights. Um, but two, it's not going to work, because a lot of people, some people may comply, but a lot of people will feel compelled now to do the exact opposite.
What you're saying, I was just wondering, is also fundamental to even a medical practice, or a dental practice face to face. You can't even tell a patient who has walked into your clinic seeking help to just do this or do that. The prescription that you've written is like, it's a prescription, but there is no, like, it's an order to. Although you discussed the dictatorial nature of doctors as well, but that dictatorial nature is precisely coming out of lack of training, because they can't handle
Absolutely.
the
Yeah, lack
information
of
which is out
training.
there.
Because as you say, and I've seen it, a doctor who tries to force a patient to take a prescription, patient walks out of the surgery and throws the prescription in the bin. Do you know what I mean? Like, they won't tell the doctor to their face, look, I'm not going to be forced by you to take this medication, or change my behavior. They'll sit there and with a blank face, but you see them walk out, and you know so yeah, it bad training. If again, doctors, dentists, medical professionals of any sort, public health, you have to understand human behavior, that you cannot force humans. They're thinking beings, and they'll
They have
make their own
agency.
decisions. All you can do is educate, and when you educate a patient why that drug prescription's important, why maybe they don't want to do it, but why it's important to their family, and you sort of you find what their motivations are, and then you'll get very high success rates in terms of compliance.
Just hear
And
them
these
out.
are the tools as clinicians that we've acquired over decades of practice. Do you know what I mean? Yeah, you get a sense that the training, is failing now because people think the training is about learning facts. It's not. If you want to be a medical practitioner of any sort, the first thing you have to learn is human psychology and
Absolutely.
human autonomy.
Absolutely.
Do you know what I mean? If you don't understand those two principles, you're going to be an absolutely lousy health, practitioner. You mightn't appreciate it, like you might think writing all those scripts you're doing good, but if none of your patients are taking those scripts, and because they think you're a dictator and that you don't understand them, and you're trying to force them, do you know what I mean? You're a lousy doctor. So you can pat yourself on the back all you like, but in reality, it's what's the outcome. You know what I mean? It's not whether you've written hundreds of scripts. It's, are the patients taking those hundreds of scripts? Are they getting the benefit of it? And that's where I think the with poor training, we're seeing this whole crop of medical practitioners and particularly public health practitioners who are doing a lousy job, but they don't seem to realize it, because they've had such poor training. And I think now also they surround themselves with other people who also have poor training, and they reinforce each other's behavior. They pat each other on the back and say we're doing a wonderful job, but they don't look at outcomes, because if they looked at the outcomes, you know, they might be shocked. They pat themselves on the back, they're running an alcohol campaign, but if more people are presenting with alcohol related disease, they're not doing a good job. They might run all the campaigns in the world and think this is wonderful. But again, they're missing the point. Because as a clinician, it's you have to look at the outcome. What is the outcome? Are people healthier as a result of what I'm doing or not? But I get a sense these people aren't interested in that, because maybe intuitively they know the outcomes may not match up with what their view of themselves and their view of their competency. Because these people are often in very high up positions, making major
That's
decisions
right.
for, and unfortunately, looking at it as an impartial observer, you'd say they're lousy at their job.
As always, thank you very much for your time, and we continue our discussion in our next
It's
episode.
always a pleasure.